Hi everyone, welcome to today's webinar on washing away diseases 2 hands at a time. My name is Hannah Woodburn. I am the Secretary Director at the Global Public-Private Partnership for Handwashing. We're a coalition of organizations who promote handwashing soap as a way to end preventable childhood deaths from diseases such as diarrhea and pneumonia. We are very excited to join the USAID WASHplus project and co-hosting this important discussion about the role of water, sanitation, and hygiene in neglected tropical diseases and how new approaches and multi-sectoral initiatives can promote better health and well-being. We have a panel of expert presenters, and I will act as the facilitator throughout this webinar. Before we go to the presentations, I want to go over a few logistical items. If you are on Twitter, please share your thoughts and reflections using hashtag WASH4, that's the number 4, NTDs. You can find the PPPHW on Twitter at Handwashing. So, your microphone will be muted during the presentations to reduce background noises. And then following the presentations, we'll have about 20 minutes for discussion where presenters will address your questions. If you have questions that arise during the presentations, please feel free to use the chat box, which is located at the right side of your screen, to ask questions during any time. And then we'll batch the questions and as many as possible during the discussion period. A recording of this webinar will be available on our website, which is www.globalhandwashing.org, and the WASHplus website, which is www.washplus.org. You will also be able to find links to the recording on our social media channels. So next we'll go to the agenda so you can see what we have in store for you all. We're going to look at the link between WASH and NTDs, how we can work together to achieve goals, what integration and practice looks like, and then finally have the question and answer period like I mentioned. So our first speaker today is Mary Wenger. She is a Senior Environmental Health Advisor at USAID's Bureau for Global Health, and she'll offer some insights on the subject of WASH and NTDs, as well as background on the USAID WASHplus project.
Welcome to the webinar. I think it's wonderful that we have so many people interested in the linkages between WASH and neglected tropical diseases. USAID, like a number of agencies with us today, is integrating WASH into NTD programs when possible, or fostering collaboration or coordination between these programs, because we know that if key WASH interventions aren't part of the NTD implementation strategy, we won't reach our goals of eradicating, eliminating, and controlling WASH-related NTDs. In the spirit of integration, USAID's Environmental Health Program and the USAID-sponsored WASHplus project joined forces with the NTD program in our Bureau for Global Health to launch the program in Burkina Faso that you'll hear more about today. With that brief intro, I would like to pass it on to Renuka Berry, who is our integration focal point at WASHplus, who will tell you more about the linkage between WASH and NTDs.
Hello, everybody. This is Renuka Berry. I'm here because I don't know who's on the webinar. We wanted to start with a little bit about what are NTDs and how is WASH related to that. The World Health Organization classifies 17 diseases as neglected tropical diseases. And more than 1 billion people suffer from one or more of these painful and debilitating diseases, which disproportionately affects poor and rural populations around the world. These NTDs cause severe sickness and disability. They compromise mental and physical development. They contribute to childhood malnutrition. They reduce school enrollment and hinder economic productivity. This group of diseases was called neglected because most health programs did not really focus on them. And by calling them neglected, it has brought renewed attention to them. Now, improved WASH practices can help prevent 3 of these neglected tropical diseases, and they are of interest to USAID in particular. There's soil-transmitted helminths, which are worms. There's trachoma, and there's schistosis. And water is also very important in the care of lymphatic filariasis. Next slide, please. So soil-transmitted helminths, the first line of prevention is mass drug administration. So that to flush the worms out of the system. But in order to prevent reinfection, we need effective sanitation, sewage disposal and treatment, and shoes, especially to prevent hookworm, because they come up through the feet often. Next slide, please. Schistosomiasis is called bilharzia, and it's caused by flatworms. There are two kinds of schistosomiasis. There's urinary and intestinal. And these diseases cause damage to the bladder, to the kidneys, to the liver, to the spleen and the intestine. And in children, the diseases cause anemia and stunting, which results in a reduced ability to learn. In adults, it causes chronic diseases. WHO has established targets and milestones for eliminating schistosomiasis toward this goal, and 75% of national coverage in all countries requires preventive chemotherapy, or the mass drug administration. And WHO also states that in addition to delivering effective chemotherapy, countries require hygiene education, improved sanitation, safe drinking water, and snail control. And another thing is no peeing in rivers and lakes, because that is another way that the disease gets reintroduced into the environment and the cycle continues. Next slide, please. Trachoma is caused by chlamydia trachomitis. Children often get repeated infections, and this means that the eyelids turn inward and the eyelashes rub and scar the cornea. And after repeated infections, this can cause irreversible blindness. In 1998, WHO formed the Alliance for Global Elimination of Blinding Trachoma by 2020, which is called the GET 2020. And in this process, they introduced something called the SAFE strategy, which you'll hear more about. But it means the S is for surgery for individuals with advanced trachoma. The A is for antibiotics to reduce the chlamydial infection. F is for facial cleanliness to reduce the risk of continued transmission. And E is for environmental improvements, which include safely managing human and animal excreta, promoting hygienic behaviors to change those that spread disease, and improving access to water and sanitation. Next slide, please. So really, we need to focus on behaviors. Without a serious focus on face washing and environmental cleanliness, areas of high trachoma prevalence will persist. And in areas of schistosomiasis and soil-transmitted helminths, these diseases will continue to surge with little hope of control, much less elimination, unless a strong emphasis is placed on sanitation and changes in key behaviors. These are the behaviors, as you see on the screen, that need special attention to keep the focus on preventing wash-related NTDs. And you'll see on the top are sort of the classic wash behaviors with an addition of face washing. And on the bottom are more behaviors related specifically to NTDs and water and sanitation. Next slide, please. So this slide shows sort of how WASH and NTDs overlap. Now, USAID is currently focused on helping governments design and implement national mass drug administration programs in those areas that are endemic for disease. Several drug companies donate the drugs, and USAID is assisting countries to implement mass drug administration programs and monitor the disease levels in the country. And as Mary said, USAID also has supported the WASHplus project to explore the intersection of WASH and NTDs and to develop a model program that can be shared and adapted around the world to promote integrated approaches. At the same time, and perhaps even before, the NTD community has also started to tackle WASH and NTD integration because it's critical to meet the eradication, elimination, and control goals. Many efforts are currently underway to promote integration, and you're going to hear about some of them today. Thank you so much.
Thanks, Renu. So I'm gonna start my presentation by just saying that what Renu just presented is that there's clear linkages between WASH and NTDs, and actually many of the prevention and control strategy on NTDs actually do highlight WASH as a key public health intervention. The WHO roadmap on NTDs, which was launched in 2012 and which guides the implementation of policies and strategy on NTDs, includes WASH as one of the key interventions alongside chemotherapy, vector control, zoonotic control, and disease management. In practice, though, I mean, historically, the collaboration between NTD and WASH program has been often quite limited. Of course, there are examples of integrated approaches. I mean, guinea worm programs are a classical example, I would say, and also, as Renu mentioned, the trachoma and the SAFE strategy. So I just wanted to mention that in the past couple of years, there's been really a growing recognition that from both the WASH and the NTD community, that there's lots of opportunities to work more closely together and to optimize the use of resources and improve the effectiveness of interventions. I mean, as the last diagram from Renu's slides has shown, is that both WASH and NTD programs, they, of course, they focus on different outcomes, and often involve different ministries, but they concern equally about improving health of those most affected, about eliminating inequalities, and reducing poverty. For the NTD sector, the WHO roadmap has set targets for 2020, which is only just 5 years from now, and for many NTDs, and I just think about the example of soil-transmitted ailments here, mass drug administration alone can't prevent reinfection. So WASH is really needed to break the cycle of transmission. For the WASH community, we know that there's massive inequalities that persist. And according to the latest WHO-UNICEF Joint Monitoring Program report, we know that 7 out of 10 people are without improved sanitation actually live in rural areas, and 9 out of 10 who practice the open defecation live in rural areas. And we also know that poor access to WASH is really affecting a population in the lowest wealth quintiles. So with the Sustainable Development Goals, the focus on universal access to basic WASH services by 2030 really means that more needs to be done to better target investments at those poorest population, those who are most affected by NTDs. I mean, in response to the growing momentum, and here on the slides, I just wanted to acknowledge that there's been lots of efforts, and I'm sure that many of you in the audience have contributed to those efforts. There's been roundtable discussions involving researchers, implementers, donors, countries, and in response to the growing momentum for strengthening collaboration between WASH and NTD programs, WHO released this global strategy. Next slide, please. So the strategy really builds on those efforts and really aim to mobilize WASH and NTD communities globally and in countries and try to accelerate all the efforts that have been put into this in the last few years, but also to provide some guidance and provide some example of concrete actions that can be taken to accelerate those efforts. And these actions are grouped into four main areas, which are called strategic objectives, which includes awareness raising, monitoring, research, and implementation. Next slides, please. So as I just said, there's four main strategic objectives, and I won't go into too many details, but I just wanted to highlight a couple of things under each. And I guess the first point about awareness, I think we need to know more about what is being done in practice. I think it's really important to document national case studies and learning more about challenges and opportunities and share information. We're currently working on developing a template for case studies development and planning to disseminate it among implementers and partners. I mean, there's examples that are emerging. Just thinking, for example, in Ethiopia and perhaps in Burkina Faso. We're going to hear a little bit more about it later, but I think as those more and more examples emerge, I think it's important to capture the lessons learned. In terms of monitoring, at global level, GMP is moving towards monitoring inequalities, and they are currently exploring a number of approaches to track inequalities in access to WASH services. So they're trying to explore whether some national analysis of NTD distribution could potentially be used as a tracer or proxy for inequalities in access to WASH. At national level, there's already some mapping initiatives that produce some country profiles and provide district-level estimates. But I think there are opportunities to do more in terms of joint data collections, but also sharing epidemiological information and WASH access and coverage information to better target, better prioritize on areas that are in needs. In terms of evidence, I think a lot of systematic reviews have been published in recent years, looking at the health impacts of WASH intervention on some of the NTDs. But I think more needs to be learned about, the kind of implementation, learning about documenting processes of delivery. How can we better implement WASH alongside mass drug administration, for example, so that it adds value, it's effective. And again, I guess it's important to make sure that this new information is feeding back into existing training materials, tools, and guidance documents. In terms of implementation, again, I think at country level, it's really important to strengthen communication between WASH and NTD sectors, and that could be setting up institutional arrangements, or it can be simply just having a WASH representative taking part in some of the key NTD program planning meeting and vice versa, so that to make sure that the activities are better aligned. Again, I think it's really important that there's more at the planning stage. There's more sharing of information on disease endemicity and WASH coverage for better targeting of intervention. I mean, we know that there's plenty of challenges, and we're not recommending to do everything together all the time. But I think it's about identifying when it makes sense, when it can add value and optimize use of resources, and make the program more effective and improve the health of those that are most in need. Thank you.
Great, thank you so much, Sophie. Our next segment will address the practice of integration, and it's going to be delivered in two parts. The first, Yale Velleman is the Senior Policy Analyst in Health and Sanitation at WaterAid, and Jordy Woods is a Technical Advisor for NTD's Site Savers, and they will co-present on the International Coalition for Trachoma Control's F&E Planning Tool. And then after their presentations, Edward, who is the WASH NTD coordinator for the USAID WASHplus project in Burkina Faso, will describe the intervention and expected outcomes from the pilot.
Thanks, Hannah, and hi everyone. This is Yael from WaterAid. I will be together with Jordy telling you a little bit about a toolkit or a planning tool that was developed by the International Coalition for Trachoma Control on F&E, and you may recall from Renuka's presentation earlier on that F&E are the WASH-related components of the SAFE strategy for trachoma elimination, and that stands for facial cleanliness and environmental improvement. Just to say briefly, there's a link at the end of this presentation for you to be able to access this tool, because we won't be able to go into a lot of detail. So hopefully we'll just get you very excited about it so you can go and explore on your own, because we feel quite strongly that this toolkit can be quite relevant for anyone who's interested in integration between WASH and health and overall an integration, not just trachoma. So the main reason that we came up with this planning tool is that even though we've all, well, part of the WASH sector has recognized that collaborating with the NTD's community and with trachoma is important, and even though the trachoma community recognizes the importance of working together with the WASH sector, it's actually much harder to go the next step and bring people together around the table to make decisions and deliver services together. And when we started exploring why that is, we realized that a lot of the times the reasons for that are actually very simple, very boring things that keep people very occupied on just the things that they're used to delivering. And in the absence of that kind of collaboration, you end up with WASH stakeholders that are perhaps not targeting resources properly towards trachoma endemic communities in parts of the country. And you end up sometimes with trachoma organizations having to deliver WASH interventions themselves, which is not ideal. So here is what we did. If I could have the next slide, please. We developed this planning tool, which is all about trying to bring people together. So it's a planning resource to make integrated programs take place. It provides key steps for doing a joint planning approach, and it could be used in a linear fashion if you were starting from scratch, or it could be used just for delving in and getting certain tools or components depending on what stage you already are in at a country level. The main target audience for this tool is trachoma program managers working at a country level, and we've started using this planning tool with some of the existing funded programs, and Jordy will tell you a little bit more about that. But importantly, we had to communicate to people that there are a lot of things that this planning tool is not. And most importantly, it's not a best practice guide on how to do WASH. The assumption is that WASH stakeholders do WASH and NTD stakeholders do NTDs, but we need to come together to make sure that the resources are properly used and are targeting the right communities. Next slide, please. Thank you. Very, very briefly, you'll see that the planning tool is comprised of various components. The first one is basically trying to tackle head-on some of the myths that exist, the things that we think we know about one another as a community, and dispelling those one by one. It then moves into the key program management steps, starting from actually finding the right partners to work with and how to get them engaged, followed by gathering evidence. And what we mean by evidence is things like doing a context, a situational analysis to understand the environment in which the program is going to be designed. The next step is all about programming itself, how you go about planning and delivering the different parts of a joint program. And then the final bit, which is learning, it's called learning here, but is actually all about that wonderful and exciting field called monitoring and evaluation, which often becomes a very difficult part, especially when you're trying to do it jointly with other stakeholders. Throughout the toolkit, we're using practical examples for each and every one of these components. So how has this worked in the past? What might a situational analysis look like? How do you approach partners? What kind of behavior change programs have been used successfully in trachoma, and so on and so forth. And then we try and highlight specific bits of information and critical success factors that we feel are most important to make the program happen. Next slide, please. Thank you. So this is just a little example of the first parts of the toolkit. We, for example, know that there are misconceptions within the NTD's world about how much money and influence the WASH sector may have, and that, about how easy it is to provide services in remote areas where trachoma is endemic. We tackle issues around things like investment in water and sanitation. One of the things that are not always very obvious to people working outside the WASH sector is that the initial capital investment in infrastructure is only a fraction of what is actually needed for spending in the WASH sector when we start thinking about things like operation and maintenance. We talk about things like what happens if instead of open defecation you have sanitation that's not good enough. Is that sustainable? Is that good enough for disease control? And I think we can all answer that question. So that's just an idea of what we're trying to do with the myth-busting section. Next slide, please. So before I hand over to Geordie, you may remember the lovely Venn diagram in Renu's presentation that talks about how instead of expecting each community to buy into the objectives of the other community, it's probably easier to try and identify a shared objective that we can all work together on. So rather than trying to convince the WASH sector that it should work on trachoma elimination, the idea is that you bring all the partners and stakeholders together around the joint objective of well-being, improved health and prosperity, and assuming that that objective is actually at the heart of what all of the development sectors are trying to do. So this little diagram is an expansion of that Venn diagram, because when it comes to trachoma elimination, we also need to involve various other communities and sectors, whether it's the health sector at large, education sector for work that we need to do in schools, and then corporates, especially when it comes to things like marketing sanitation or increasing access to important commodities such as soap. And we spent quite a lot of time in the toolkit explaining how you might be able to convince these stakeholders to get involved in the program, and then even going down to the level of detail of once you get them to agree to meet, what would your discussion look like? what sort of information would you need to keep them engaged and then move towards the next stage of the collaboration. So I'm going to hand over to Geordie, and he'll be able to tell us how the toolkit has actually been used in practice. Thank you.
Thanks, Yael. Thank you, everybody, for joining us, those who are with us. And I just wanted to reiterate, as Yael stated at the beginning, that first of all, this toolkit has been a collaboration of a lot of different folks from both the NTD side and the WASH sector side. And that also that while this toolkit is specifically focused on trachoma, again, it really is meant to be a tool for integrating in any health sector, any other NTDs, other health programs with water and sanitation. So on to what has come of the toolkit. It's been out for a little bit now, and I'm going to give just sort of two specific examples of steps 2 and 3 of that project management cycle that Yael had mentioned. And the first of those was step 2, which is the evidence part, bringing together what do we know, and kind of going back to Sophie's presentation where she had mentioned really the importance of the planning stage, and because that really is such a critical piece. So part of the toolkit, one of the tools in there is a situation analysis template, and it's essentially a template that walks any program through a number of questions to answer about what the actual situation is with regards to WASH programming that exists, as well as trachoma, in this case, programming that exists, and where those overlap, and how it provides a number of templates for mapping, understanding how actually program management works within the water sector and the health sector. So the 3 analyses that you see up here are just 3 from Chad, Tanzania, and Ethiopia. So far, under several funded trachoma programs, we've undertaken this process in 6 countries total. So the other 3 that are not up here are Kenya, Malawi, and Uganda. And that's been kind of the process or the template for learning about building this toolkit. So I won't go too much more into this, but those situation analyses are out and can also be shared with folks that are interested in that. So next slide, please. And then sort of the next piece is sort of, how does catalyzing this intersectoral action happen? That's a lot of jargon to talk, but basically, I think that the development of this toolkit in and of itself is a really clear example of intersectoral action and collaboration. As I mentioned, developing this and getting this produced was a huge effort from a lot of different actors, and part of this has involved presentations at various different international conferences, both in the water sector and in the health sector. So it really was, I think, this represents a very clear collaboration between trachoma and the WASH sector. And then just 2 other examples highlighting, a lot has happened around planning using this toolkit. Everything from kind of building budgets and developing tools. So the second, or the third component of that project management cycle is again, sort of the programming piece. So after we've got the situation analysis, coming together and sitting with all of the relevant stakeholders and saying, right, what do we want to do? So a good example, I think, is in the Zambia trachoma program. They are working with using data collection methods to reach elimination. So really, looking at this from a different perspective, using the water and sanitation data to help inform how best to move along actually at a district level and ensuring that information is catalyzing trachoma elimination prevention program. And then the other example I wanted to highlight is there was recently the F&E planning workshop that was held in Ethiopia, and what was really interesting about that particular planning workshop was that it really brought together folks who had never sat together in a room to plan. We had behavior change experts from several different universities across Ethiopia who, so that was really bringing academia into the planning process. We had the WHO in Ethiopia present, and then we had a number of different organizations from both the health and WASH sectors. And, while this sounds also natural and relevant, it really was something special to see this group of people in a room planning, and I think that the ideas that came out of that are going to end up in some very interesting programming for you to do. So again, please reach out to us, look at the toolkit, and use it. So thank you very much. Next slide.
Hi everyone, I'm Edward from Burkina Faso. I'm talking to you from Burkina Faso, where the USAID funded WASHplus project is implementing a short but very intensive pilot set of activities integrating WASH and NTD and trying to bring together WASH community and then NTD communities to collaborate. Next slide, please. So I'm going to start with giving you like a brief idea of the WASH and NTD, of the NTD and WASH landscape in Burkina Faso. So as Sophie mentions, we have an NTD National Neglected Tropical Diseases Program here. They focus mostly on mass drug administration. Of course, they also have behavior change activities, but just around the mass drug administration. So there's not a set of behavior change activities this program is doing. We also have a WASH sector which is managed by the Ministry of Agriculture, Hydraulics, Water and Sanitation. And this sector is mostly water focused because we still have problem here having access to clean water. So the main focus for this program is still clean water provision to people, less than sanitation and behavior changes. And there's some platform for coordination, but there's no actual platform for specific NTD and WASH coordination, and this is the gap we want to fill. And then one thing is we should say is that we have a lot of NGOs working in the WASH sector in Burkina Faso because the need is big and we have a lot of people working here. Okay, so next slide, please. So that you know where we're working. Next slide. Burkina Faso is located in West Africa, and we have chosen one province of Burkina Faso, which is in the eastern region, and this province have 2 health districts. So we are working in those 2 health districts. Now, how do we design this pilot project? We design it in 3 steps. So of course we have a background of how we choose Burkina Faso, what is the context of Burkina Faso. So how do we choose how do we choose the area where we work in? So we try to understand the context and see who is doing what there, who is doing what, who can we collaborate with, what is the situation on the field there. And then we try after this to engage our stakeholders at multiple levels. So what we did is we talk with, we speak with the people at the national level, those ministries that are involved, the Ministry of Health, the Ministry of Education, the Ministry of Agriculture and Water. And then from the national level, they direct us to the regional level and then to the local level, which are actually the health district and where we are working. So we took work with those people, trying to bring them together and then trying to make them understand the rationale between WASH, the importance for WASH. We also talk with the municipalities. Those are the communes. When you take like a village, you have the commune which is responsible of the village. They are in charge of the water provision for this village, and they also have the agents. Those people give behavior change. They have behavior change activities toward the communities, but they don't have necessarily knowledge and then of entities. And you also have the health system, and those health people at the local level, they are in charge of the health of the people including mass drug administration, and those two communities work like separately. So the idea is that we bring them together, using the people for the municipalities, for let's say the WASH community there, to deliver at the same time entity-related messages, and having those people for the health district who are in charge of the entity problems and the mass drug administration to also work hand in hand with the community people who are in charge of the WASH. And beside this, we were able to engage like WASH sectors, NGOs like how to say, Register, which is also a USAID funded project, and they have an approach like a rolling board, they call it mother to mother, trying to have mother leaders and then coming with more and more women to the activities. And we are using those platforms like for them to disseminate our wash and NTD messages also. So we also trying to work with conveners like we see, like UNICEF, they have the world, they have the heavy words in the wash community, yes. So they have platform where we can do to share the result of our work. So we also work with community-based organization, and this is including like the village chief, the political leaders in the village, the religious leaders in the village. So all those people we are building on, because previous NGOs, wash NGOs, we are working on the field, they also have like a platform where they can gather all those people. So we are using those platforms to motivate and then to advocate. Next slide, please. So the activity, the behavior change activity itself is one, developing an integrated wash and entity behavior change tools. We harness on what people are already using here in Burkina Faso, that are mostly the fast tool. And then because we did a baseline before, so we have a set of indicators we want to change. So we use those indicators to add to the messages people have, and then we make it like off and then like it's validated by the Ministry of Health. It's going to be validated by the Ministry of Health, the Ministry of Agriculture, the Ministry of Education, and we'll make it available for all those partners working in the field. We also training communities to give them to enhance their capacity, so they have more knowledge of the linkage between wash and NTD and the behaviors and the good behaviors to take. So we're going to implement also a CLTS using our integrated wash and NTD tools, and this is something new. There's a new momentum in Burkina Faso towards CLTS because we didn't implement CLTS before. And we do think that if we can use like wash and NTD, wash messages directed to neglected tropical disease, for those triggering, it will be a good starting point for us. So we also training specific groups. When I say specific groups, it's mean teachers. We're training teachers, we're training community health workers, we're training health workers, giving them some knowledge of why wash matters for NTD and what we can do at each of our levels there. So we also partner with site servers to implement a radio campaign promoting wash and NTD neglect or wash and NTD messages, and this is to happen very, very, very soon. We are embedding some of our activities, let's say, behavior change activities around the mass drug administration campaign, and this is to happen in May because the Ministry of Health is planning to have next mass administration campaign in May. And we are trying to embed, and then around this period, do more and more wash activities in the villages. So, next slide, please. So far, what we can say actually, is we were able at the very local level, because we are working, it's a pilot project, we are working at the local level. So we were actually able to bring those wash communities and the NTD communities at the local level to use the same tools, and then to use the same agent for like wash and then NTD activities. And this is the kind of model how we cooperate with NGOs that are on the field. And we want to bring this learning back at the regional level to say, we were on the field in the Mani district, in the health district. This is what we have done with this NGO, with this NGO. This is how we have collaborated. And then from those lessons, we think that we can bring the lesson back to the national level and then advocate for it to be like in the policy. So at in terms of output, we expect that we will be able to improve by this collaboration to have an improved knowledge of key behaviors in terms of NTD preventions, and then also improve behaviors in terms of wash related behaviors. I think that is all.
Great. Thank you so much for that presentation. I think that we've all learned a lot for this webinar. So at this time, we are going to move to the question and answer portion of the webinar. We have about 7 minutes left, and so we won't be able to get through all of the questions, unfortunately, but we will post questions and answers on our website along with the recording of this webinar. So if you've typed a question in the question and answer box and we have not gotten to it, check for where the recording is. And we'll address the question at that time. So we're going to go through questions in order that we've received them. So the first question that we are going to address is, what are the biggest challenges that are faced in WASH and NTD integration? And that's a general question, so any of the panelists feel free to chime in.
This is Renu. I think there are many different kinds of challenges. I think one huge challenge is just different languages. So the NTD community, the WASH community, the health community, the education community all speak different languages. And it's really essential to kind of get onto the same page. So that's one challenge.
I think that's a great point, Renu, and I think that's definitely something that with the F&E toolkit that struck me is the kind of dispelling myths about other sectors, and I think getting on the same page in terms of language is really important as well.
Hi everyone, it's Yael here from WaterAid. I agree with Renu's point, and I'd like to add one, that when you have different sectors that are funded in a very different way, especially if you have a lot of earmarked funding that's dedicated to specific activities, it's actually very hard to implement integrated programs that would require you to share your financial resources with others. So one of the things that we try and address in the planning tool is things like understanding the financial arrangements in each of the communities and the different stakeholders, understanding the budgeting cycles of the different sectors, and seeing what kind of arrangements you could have around planning that leads to spending that is joint, even if you don't end up pooling your resources together, which a restricted or an earmarked grant won't enable you to do. But there's a lot of very vertical aid that goes into the health sector, and that to me is one of the biggest challenges overall for WASH and health integration.
To add, one of the biggest challenges is how the two communities see the common goals. We now have talked about the common goals. How do the two communities see the common goals? I mean, people, it's obvious the importance of WASH for the NTD's elimination is obvious. Like in countries like in Burkina Faso, where priorities for the WASH community is providing clean water to people. Yet this is a priority. So how do we have those WASH people to have common goals with the NTD people? This is the one of the biggest challenges.
Great, thanks. So the next question comes from Felix, and this question pertains to challenges in Burundi. The question is, what are concrete strategies that the WHO and others use to fight NTDs in countries where there is political instability or a lack of political will? There might be security challenges, as well as addressing some of the components of WASH programs that might be more expensive.
This is Renu. I'm not exactly sure how to sort of respond to that, but I think there are many different ways that things can happen, and I know that in the WASHplus integration work, we've done integration in many different ways. Sometimes it's been very deliberate and very integrated from the start, so we can plan and implement something in an integrated fashion. But at other times, we've kind of tried to be opportunistic. So if there's a water and sanitation program that's ongoing, maybe we would try to add an NTD component or a nutrition component to one of the integrated areas. It's maybe not ideal, but maybe it's better than nothing.
Great, thank you. Ashley asks, what type of evidence is needed for WASH program design?
Yeah, this is Sophie here. Yeah, for WASH programs, so what do you mean exactly for how to implement WASH alongside other NTD program components?
I would
For
imagine,
example?
yeah, I would imagine
Right.
that's the case.
Well, I think it would be often in research, I think, although I think it's changing, but there hasn't been sufficient focus on documenting how interventions are actually implemented, or at least certainly for WASH. And there's been lots of RCTs published on WASH intervention, for example, but I think documenting how interventions are implemented and documenting those processes, better understanding, kind of unpacking this kind of black box of what's going on when interventions are implementing, when interventions are combined, where we link some components. I think it's really important. So I think that's definitely one area. Another area, I think, there's in the WASH sector, there's been lots of research into behavior change approach, using innovative behavior change approaches, and I think some of the messaging around TDs and WASH practices for specifically for certain NTDs. I think there's there's lots to be. I mean, we could learn from those existing approach and adapt those. So I think yeah, these are the two areas that I would but these are two examples, of course.
Great, thank you so much. This is, so one of the questions is, where can we access the F&E Planning Improvement Toolkit? So that'll be posted online. There's links to it that we can post along with the presentation, so check our website for that. This is a great question. How can we integrate WASH and NTDs with this through the CLTS approach? And we're right at time, so this will be our last question.
From Burkina Faso. So we have designed the tools with some of our partners, and one of the partners is Regisair. And Regisair have an extensive experience in the area where we're working. They have like what they call the main schools of husbands, and another one is MTM, mothers to mothers, and then we are planning to give them our tools because they are also doing CLTS in other villages nearby where we are doing. So we are not working, going back to do what they have done there. But in the area where we are working, where they already have the groups, I mean the husband schools and the mother to mothers group. So this is for follow-up. This is for follow-up after the triggering, after the community engagement, and after start building the facilities. How we keep the momentum, how we keep them using it, how we keep follow-up, how we keep the follow-up. And those are the tools we are going to give to those organizations because we are not there for so long. And they are going to stay there for so long. So they can use the tools for the follow-up and then keeping the momentum, and then for the people, not only to keep building latrines, but keep using them and having the good behavior in terms of sanitation and hygiene. That's it.
Great, thank you so much. All right, so that is going to do it for the question and answer period of this webinar. I want to say a big thank you to our colleagues who have joined us in sharing their thoughts and tools about how we can better address integration of WASH and NTD initiatives. As I mentioned earlier, the materials will all be on our website as well as the WASHplus project's website. So thank you all for joining us for this webinar, and if you have any additional questions, please feel free to email us. Our email is contact@globalhandwashing.org. And with that, we'll end the webinar. Thank you all.